Hello, welcome to Neonatal Physical Assessment with me, Ibu Kinan. Today's objectives is to define what is neonate, and then to see what changes happen in newborn baby, and then to see what is the normal neonatal criteria, and then to do assessment for a normal neonatal, and then to do assessment for reflexes on neonatal. So, definition of neonatal. So, WHO define neonate as the newborn infant or a child within 20 days of age. And in this time of life, the baby is really having the highest risk for dying, especially in the developing countries where they don't have access to good quality health care. So, to ensure the life of neonatal, it is important to make sure that they have a good and strong healthcare services with skilled healthcare professionals, as well as availability of healthcare facilities which are able to handle emergency cases. And WHO actually has provided a step-by-step guide for early essential newborn care, or EENC, which includes the skin-to-skin contact as early and as long as possible, and early and exclusive breastfeeding, as well to ensure that the baby will have an increase in survival changes and has a good foundations for healthy life. So what changes will we see on a newborn baby? So the first one is related to the immediate adjustment once the baby is born, living from intrauterine to extrauterine situation. So the first one will have a change in respiratory system, where the baby will try to breathe on her or his own, which is influences by chemical factors, thermal stimulus, and also tactile stimulations. Once the respiratory system has the immediate adjustment, circulatory system also will follow, and then this circulatory changes marked by the closures of the fetal shunts within the baby. Other physiological status that are changing during the baby once it is born is actually the thermoregulation system, and we have to notice that there are three important facts about baby: that the baby has a very large area of surface on her body or his body, which contribute on losing heat, and then also the baby born with a thin presence of subcutaneous fat, which make the baby won't be able to maintain the heat within the body, as well as the incomplete mechanism of thermal regulations, which leave the baby to have a non-suffering thermogenesis. So really relies on the presence of brown fat, or what we know brown adipose tissues within the skin. So that's why we have to be really mindful in making sure that the baby will not lose heat. And another system that having changes is the hematopoietic system, which the blood system of the body of the baby. So the baby will receive around 300 milliliters blood, which come from the placenta once the baby has been born. Next changes are in the fluid and electrolyte balance, so that the body of the baby will contain 73% of water, where also having an increased metabolism rate, which is double the rate of the adult. And then in gastrointestinal system, we will notice that the digestive system is actually not functioning very well, but then the breast milk also contains lipase, which help the absorption, so it's okay for baby to get breast milk during their first days of life. Meanwhile, the liver is also immature, and then this can also cause a physiological jaundice on baby. And we also know that the salivary glands in baby are not functioning until 2 or 3 months old, and the intestine in the baby are definitely longer than in adult. Other changes are the renal system. So the renal system will produce around 200 and 300 milliliters urine in the first week of life, which equals to 50 milliliters in every void or urination, which will happen around 20 times a day. And in the integumentary system, we know that the structures of skins are actually complete, but these are not able to function perfectly yet. So we have to make sure that the baby got like cover on their skin. And for musculoskeletal system, the skeletal system will be developing very fast in this first few days of life, as well as the musculosystem that are already completed but needs to function. Another changes is regarding the defenses against infection. So baby, once it's born, it will use 3 systems of infections defenses, which are using the skin and mucous membrane as usual, using the macrophage system where we have neutrophils, monocytes, eosinophils, lymphocytes to eat the bacteria and all the infections that's coming, and also the antibodies development within the body of the baby. Another changes will be in endocrine system, that the system of endocrine is already formed but still immature, so some of the hormones will be in unstable number, which will make also the baby, if it's a female baby, she will have a pseudo menstruations time. And another system that's changing is also neurological system, where there will be the presence of primitive reflexes that will cease as the baby growing up, and the autonomic nervous system really plays an important role in this few days life of babies. Another thing is about the sensory function of the baby. We have 5 senses, and one of these are vision. So the eyes of the baby are eventually not ready yet. It's not mature, but it's reacted to the light, and it cannot produce tears yet until 2 to 4 weeks old. And the hearing of the baby actually reacted to a very loud voice, more than 90 decibel, and the baby can actually hear the mom's voice at birth and also differentiating the voices, whether it's the mother's voice or not the mother's voice. About the smell, the baby can eventually smell the breast milk from the mom and also differentiate which is as not the breast milk from the mom. With the taste, the baby can taste differently and create an expression in every different taste, as well as the touch, that the baby will feel the tactile sensations, especially on face, mouth, hand, and the soles of the feet. So once the baby is born, we are going to do the immediate neonatal assessment. So the nurse will immediately perform this assessment to the baby, starting with the suctions to the mouth, pharyngeal or endotracheal, which be done according to the policy in each facility. Then the baby will be moved, placed under an infant warmer, wrapped with a sterile warm cloth, and then the skin will be dried, and nurses will observe the breathing effort of the baby, the color of the skin, the muscle tone, as well as maybe stimulate the baby to be able to breathe and cry. If the baby is okay, then baby will be given to the mother for a skin-to-skin contact. During these observations, nurse also observe whether there is difficulties on breathing, assess the pulse on the umbilical cord, make sure that the umbilical cord has 2 arteries in 1 vein, and then also put the thermoprobe to measure the temperature, as well as another probe to measure the pulse and oxygen saturations. Once this been done, baby is going to be identified with the mother, and then mother is going to be given identification bracelet for the baby as well as the mother. So the mother will have, and the baby also will have, identification bracelet to prevent the baby from abduction. Next one is Apgar score. So once the baby is born, we are going to do the Apgar score on the 1st and the 5th minute of the birth. And these are the table. If you can see over here, the table of Apgar score. Apgar contains of appearance, pulse, grimace, activity, and respiration. and we are going to just measure how's the baby. If the baby is entirely pink, we give 2 points. The pulse is more than 100, 2 points. Baby cries for 2 points. Active movement, 2 points. If like the cry is like really loud, then it's another 2 points. So once the baby got a score, 0 to 3 means that the baby have distress, 4 to 6 means baby have a moderate difficulty, and then 7 to 10 means that the baby has no difficulty in adjusting to extrauterine life. If the baby has score less than 9, maybe baby needs to be stabilized for a moment, but then if not, then the baby can have like directly skin contact with mother. Next one is, what are the criteria for a normal neonate? So as a baby born, we have to check if this baby is normal according to the gestational age, as well as we check the physiological sides of the baby. Respiratory needs to be 30 to 60 breaths per minute. Pulse needs to be 120 to 160 beats per minute. The temperature needs to be 30.5 to 37.6 Celsius. The skin color will be pink. The gestation age will be more than 37 weeks, or ideally 38 to 42 weeks. And the weight will be around 2,500 to 4,300 grams, with the length of the baby 45 centimeter to 54 centimeters. And the head circumference of the baby will be around 33 to 35, with chest circumference also around 30 to 33. Now, once baby is born, we know that baby don't have the immune system yet, so infections might happen. So what we do to prevent, first one is to do hand washing, and after the baby is born, we also give like prophylactic ophthalmic to prevent eye infections on baby, and baby also receive vitamin K injection intramuscularly, and then we also check for the blood sugar, hemoglobin, and hematocrit on the babies. Next, what we do for assessment in the normal neonate, we see the general appearance of the baby. We see if the posture is good with the flexions of head and extremities. We see if the skin is normal, red, puffy, smooth with Sernix sesosa. And then we see if there is any lanugo. We see if there is likely edema on the eyes, face, feet, hands, and scrotum or labia. And then we also see that the head have a flat fontanelle with soft and firm. And next one, that the baby will have the eyes that is slightly edematous. We have to check the eye color. We have to check there is no tears. We have to check that their corneal reflex happen once we touch the eye. There is like rough pupillary reflex to the light, and then when we touch the eyes also there will be a blink reflex. And then we also have to check that the ears in line with the eyes, the top of the pinna, and then we have to check that there's a startle reflex when the baby hear a very loud sound. Next is about assessment also to the nose. We have to see that the nasal has the patency, and then the nasal will have a slightly wide discharge with the mouth and throat that high arch palate intact, with uvula in the middle, the frenulum on tongue and upper lip, with the sucking reflex, rooting reflex, gut reflex, extrusion reflex, minimal salivations, and also the baby will cry loud. With the neck, we have to see that the neck is short, it's thick, has the tonic neck reflex. On the chest, we will see that the anteroposterior postures of the chest with equilateral diameter, with slightly chest retractions and inspirations. Xiphoid processus is present. The breast will have a little bit enlargement, and on the lungs, you can see that the baby are doing the abdominal breathing. There is cough reflex after 1 or 2 weeks of age, and the breathing sounds as bronchial bilateral. With the heart, we have to see that the apex is located on intercostal 4 and 5. Next one is the assessment for normal neonate. On the abdomen, we have to see that the abdominal is cylindrical. We can palpate the liver, spleen, and kidney, and then we can see the umbilical cord with 2 arteries and 1 vein, and then we can also palpate the pulse in femoral area, and then in the female genitalia we can see that labia and clitoris likely have an edema, but we can see the urethral meatus with vernix caesosa between labia, and there's orientation that happens within 24 hours. And in the male genitalia we will see that the penis on the tip of it will have the urethral, and then we can see that there is testis in each scrotum with the orinations that happen within 24 hours. For the back and the rectum, we will see that the spine is intact. There is no opening of the spine. There's reflex of trunk incurvation and anal reflex, and we will see that the anal opening is patent, and there is meconium that will come within 48 hours. With the extremities, we have to make sure that the baby has 10 toes and 10 fingers, and then we have to see that the full range of motions is happening with pink nail bed, and we can see that there are creases on the sole with flat sole, and symmetrical extremities with good muscle tone and pulse on brachialis. For the neuromuscular system, we have to know that there is flexion and extension on the extremities, and then the baby can hold the head, can hold and can turn the head, and also hold the head in the midline. Now there will be like pictures. There are pictures of assessment in neonatal. So here we weigh the baby, and then we measure the infant length, body length, head circumference, chest circumference, and abdominal circumference. And we also measure the gestational age of the baby. So baby is 40 weeks, and at least baby needs to be around 3,500 gram for a normal one. And this one also what we call a neuromuscular maturity and physical maturity. So what we do in this Ballard score is actually we measure how good the baby on their neuromuscular maturity and on their physical maturity, and then we will have the score which will continue then with the weeks of their gestational age, which is like if it's similar. Next is the assessment for the reflexes on neonate. We have the palmar reflex, where the baby tries to touch your hands. We have the toe and plantar grabs. When we put our fingers on the plantar, the toes will like invert it to try to grab our hands. And then we have the rooting and sucking reflexes. Rooting is that when we put our thumb or our fingers on the cheek of the baby will try to go for it and then to suck. And then we have what we call extrusion reflexes. When we try to touch the tip of the tongue of the baby tongues then will follow our fingers. And then stepping reflex, and we try to make the baby stand up, and then we will see that the feet are moving, pretending like walking. Next one is tonic neck or fencing reflex. What we see here is that when we have the baby in supine position, the baby will tend to extend the arm and leg to the side which the head and jaw is turned. And then if we move the baby to the other side, the hands and feet also will move to the other side. Next one is what we call glabellar reflex, is that when we tap on the foreheads of the baby will blink for the first time and then realizing something's going on. And then Babinski reflex, we give a stroke from the plantar to the face, from the heel to the toes, and then we can see that the feet are like trying to move with this stimulation. Next one is Moro reflex. Moro reflex is when we lift up the baby head, and then the baby we release. Baby will then have an extension of both arm and flexions of the leg. Next one is the magnet reflex, is that when we press the plantar of the baby, suddenly baby will kick us. And the Gallen reflex or the trunk incurvation reflex is that when baby in the prone position, we try to move our fingers along the vertebra, and then the baby will move to the area where we are giving the stimulus. And then the crawling reflex, basically the baby being in the crawling position, and then we try to ask the baby to crawl, and then after that we can see how the baby have the reflexes. Last one is cross extension. So cross extension means that if we extend the other side of the feet, then the other feet will be doing the opposite. Alright, so that's the last slides for this material. Here are the references for these classes. Enjoy studying!